In the tranquil town of Homa Bay in western Kenya, residents pedal through life with sheer resilience. Even the pounding of long rains this time of year won't stop them going about their daily chores. But amidst this resilience, a silent killer lurks amongst the population, ravaging young lives and impoverishing families. It's called sickle cell anemia, or simply SS.
I am a sickler, and I live with the disease every day. So sometimes when you get sick, you go to the hospital because sometimes you have that, you really don't want somebody to attend to you immediately, but you have to wait in the line just like the normal people, and sometimes it is not easy. I remember last month, that is, I was sick in a place where I didn't know any doctors. That is Kenyatta. And in a place where you go to the hospital, then you have the crisis. The doctor you find there tells you there's no way he can help you. The ward is full. And you are in pain. So I just requested him maybe if he could give me the normal drugs, because me, I know whenever I'm in that kind of pain that I was going through that time, morphine normally is the best for me. So when I asked him to do so, he gave me the drug and I went home.
But Teresa Atieno's story is not common. 80% of those afflicted with SS will die before the age of 5 because they are not diagnosed. In Homa Bay County, an estimated 40% of the population in this lakeside county are either afflicted by the disease or are carriers. Teresa and her brother Leonard are both sicklers and are lucky to have made it past the 18-year age mark. The majority of children born in this region often die from other common causes, like malaria, pneumonia, and diarrhea before the age of 5. For the few that make it past childhood, their life is wrought with complications. Sicklers, for example, are 200 times more likely to die from malaria than others.
It's an inherited condition. The highest carriage of genes is amongst the Luo communities and the Luhya communities. But remember, carrying the gene is not synonymous to being clinically affected by the disease, because you need 2 genes to be affected by the disease. The estimated incidence of the condition among the newborns is about 2 out of 100 children who are born in those areas with high carriage of the gene who are affected.
In general, the western region of Kenya, as well as the coast, has a high sickle cell burden. And in particular in Homa Bay, I can say the burden is quite big, it's quite huge, because we see quite so many patients at our referral hospital, both as inpatients and as outpatients. The numbers are just quite big, until we had to separate them from the rest of the other patients.
But those are the lucky ones who get to the hospital. 60% of children in Kenya are not born in hospitals and so are not diagnosed or followed for SS. For persons living with a sickle cell disease, their red blood cells get deformed due to genetic mutation causing the cells to form a sickle shape. Because of the shape, the red blood cells are unable to move swiftly through the body, thus clogging veins and causing acute pains in patients. Consequently, oxygen to body tissues is cut off, resulting in stunted growth and constant fatigue in young children.
Tulijua akiwa mtoto. Mara tulikuwa tunashinda kwa hospitali, joto ilikuwa juu zaidi. Sasa tu kujua ni nini. A month tunaweza enda hospitali hata mara 3. Sasa mwisho ndio tuliuliza daktari. Mtoto anaweza kuwa na shida gani juu tunashinda kwa hospitali. Sasa yeye ndiye alitoa advice, akatuandikia receipt, akatuambia tuende tupime mtoto damu. Tukampeleka akapimwa damu. Sasa vile alipimwa damu, sasa kurudi na ripoti kwake, ndiye akatuambia ako na sickle cell.
That baby, Irene Ogutu, is now a teenager.
Kana umuwa na meza diclofenac. But kama imezoea na mwili yangu, sasa nikimeza huwa haipunguzi uchungu. Sasa inameza tu for the sake, sasa hakuna chenye naweza fanya juu. Nikienda usindo huwa napatiwa ama wanani drain. Hata saa zingine nikiwa mgonjwa huwa nasema ati si Mungu achukue tu life yangu mara moja badala ya kushinda nikiteseka hapa nyumbani ati niko mgonjwa na wengine wako shuleni.
And the first disorder that we're going to talk about is sickle cell anemia.
Dr. Mishak Liru is the lead pediatrician at Homa Bay County Referral Hospital, where they handle numerous cases of sickle cell.
Sickle cell disease is one of the underlying causes of morbidity and mortality among these children that we see in our hospital here. And many of them, when they actually run just even screening tests, we find that actually they are having sickle cell. But because they have just come with pneumonia, they have come with meningitis, they have come with sepsis, we assume that actually pneumonia that killed them. But the main underlying problem actually usually is sickle cell. We have seen many of them that have come with complications like chronic osteomyelitis. You'll see them with deformed legs, deformed limbs because they have chronic infections of the bone. Because of the stigma associated with it, especially those ones who are surrounded by other fellow sicklers who have passed away. The notion is, and the message that is usually passed to them is that you will also die early. And essentially, sickle cell disease actually causes accelerated aging and early mortality.
But sicklers not only face physical pain. In Western Kenya, children born with sickle cell and their families face numerous social problems and have to endure stigma in their communities, largely due to ignorance about sickle cell and its causes, as well as cultural beliefs surrounding the disease. Meet Jane Agola, mother to Enos, her only surviving child. Jane was abandoned by her husband after she lost 6 children in succession to sickle cell-related complications. Alone and ostracized, it would take a curious trip to the hospital with her 6th surviving child before doctors finally discovered what had nearly wiped her whole family. Shunned by neighbors, Jane spends most of her time with her son. Their neighbors won't allow their children to play with Jane's son for fear that he may infect them.
Kinde duto te masebedo go kadago dala ni higni mang'eny, okuongo ni giluonga ni an gokimi. Mano obedo na malit kabisa madhi hospital modhi opima. Ka an gokimi. Koro kano opima to yudo ka aonge gokimi. Tawacho ni to kare. Nyithinda magithoni. Ang'o manego na nyithindo? Koro an iluonga to kobro bedo min nyitot. Ng'ama dwaro kata ni mondo bi dalana ka mondo miya nyathi bende onge. Nikech ang'owa nyithinda matimore nade matho. Koro kachaka ing'ona dong' gi nyathini kende ma en enosni to en bende tuo kare koro ibro luonga ni min ng'a. Koro miyo jogweng' duto alwora man kagi wacho ni watane manego ang'owa nyithinda kenda. Tuo ma nyithinda gi kithogo ni ane matimo gi nade ane mamiyo gi tho.
This disease, being genetic, can affect many members in the same family. And because it causes early death, you will see some families actually losing one child after another. They have several graves. The neighbors or other members of the society that are unaffected will always look at this family as being cursed. There are some stories that have been going around and saying children who are dying of sickle cell disease normally have that stigmata of yellowness of eyes. Sometimes they run out of blood, they are transfused. So many people actually think that this family is devil worshipping.
Our school is in a rural setup where we have so many beliefs, traditions, superstitions concerning some of these diseases. And because of lack of awareness, many students and even the parents feel that if some sickness keeps on recurring and it cannot get the cure, in many cases they attribute it to witchcraft. So sometimes they take them for some prayers. We have the jolemos. they always take them, even before they consult maybe the doctor. They first of all consult the so-called the jolemos, those who pray for them.
Sai wuwi, sai ro maler. In won ngima, in emichi ngima. Yesu wodi olungo ji, wacho ni biru ira, un mugangru ting mapek.
But for a rural setting with little awareness, divine intervention is highly regarded and sought after. Meet Pastor Enos Agueno of Asego God's Last Appeal Church, who asserts to have been healed of the disease.
I worked with the judiciary, and this disease continued, not knowing that I was a sickle celler. In 1972, I was taken to Kericho District Hospital where I was working, and that is where I was diagnosed for being a sickle celler. When I came to the church, I came in and explained to them what disease I had. They prayed for me, so I would say I was healed.
The myth that therefore one can actually be treated and get completely cured, except for those who may have undergone bone marrow transplant, for example, or what we refer to as stem cell transplant, is out of the question, because you are born with a condition, and unless the cells that carry those genes are replaced, then there is no possibility of saying that one has become cured.
Because of the myths and superstitions surrounding sickle cell disease and the lack of institutionalized basic measures such as early testing, sickle cell anemia has largely remained in the shadows in Homa Bay County. The lack of awareness of the magnitude of the disease results in poor resource allocation, working against early diagnosis and treatment of children under the ages of 5 years. Today at Homa Bay County Referral Hospital, another young life is lost as a distraught mother leaves the hospital empty-handed after losing her child to sickle cell complications, adding to the growing statistics of infant mortality.
Sickle cell. Mdomo yake ikatoka jana, sasa hapo kwa mdomo ndio ikaanza kutoka damu.
The death of her child upon arrival at the hospital perhaps underscores the challenge of timely access that many families face. Traveling from remote areas of the country, even against harsh terrains.
Just single blood donation isn't allowed in this facility, and that is also very expensive, because if I can come as a parent ready to remove blood for my child, I'll not be allowed to remove that blood alone, one person. It is quite expensive for these families. Sometimes we look for like 4 and carry them with us now if there's need up to Kisumu, because that is where the blood is going to be grouped, cross-matched, screened, so it is that expensive. Even time is a resource, it is costly.
Pengine ni usiku na amekuwa mgonjwa usiku. Sasa kulingana na vile pengine uko mbali na barabara, tunashindwa na lazima kuche ndio tukuje. Sasa challenge ni anaweza kuwa mgonjwa usiku na tushinde kumleta usiku. Madawa yenyewe tunapata shida sana kama sisi wa mama ambao tuna watoto kwa huo ugonjwa, juu pengine umeandikiwa kuja kutafuta madawa, na kulingana na mapato ya binadamu, mapato yetu yako chini zaidi. Sasa kiwango ya dawa kwenda kununua, unaweza ukaandikiwa full dose na ushindwe kununua, ukanunua hata nusu yake. Sasa hiyo nusu pengine inaisha kabla ya wakati ambao tumeambiwa tumalize full dose. Sasa inakuwa shida kwa mama yoyote yule ambao mtoto ako na huo ugonjwa.
When a family discovers that one of their children or a child has sickle cell disease, actually is devastating news. The families suffer economically because this disease drains them. It drains them financially. From day one, they have to be buying drugs. They don't come cheap. They have to be coming to the hospital. And the majority of them don't have any health insurance that can cover them. As you will see, maybe from the testimonies of the parents and the patients themselves, sickle cell disease causes poverty to the family that is affected.
Health professionals in the region believe a lot more can be done to mitigate the challenges and save lives.
As the pediatrics team, we need to fight and put it clearly to them that as much as they recognize other conditions, sickle cell should also be part of the conditions to be recognized, either in the community and also in the facilities.
The books that we are using, that are the reporting tools, they are developed by the ministry, that is the government, and for us to at least do some adjustment or create other indicators, then we cannot do it at the sub-county level. That's why you find sickle cell as a disease was not captured among the conditions that normally affect the community. So I think these cases, most of them are not reported in our health facilities or at the national level. The cases are very few, so they thought it is not a very important disease within the community. But nowadays we have realized it is with us and it's among the community.
Let it be known that it's one of the underlying killers. As at now, it looks like it's a neglected disease. No programs are focused towards its management. There is no program that provides for its, gives supplies for its management, and therefore it's a neglected disease.
In determination of policies, even if it were not to be seen for whatever reason, as a national priority, clearly for county governments within which this condition exists, it has to be nothing else but one of the top health priorities they have in their areas, because that's where the condition is concentrated. Children are suffering, they are dying, they are struggling with ill health, and they are consuming resources, health resources and manpower resources that could otherwise have even been minimized through preventive strategies.
Shikuri Foundation, we started working with them, and it was by a realization that we have a big sickle cell burden that we managed to get Shikuri Foundation on board. Previously, we used to have been working with Ambath as our partner to support our sickle cell patients. But when the Shikuri came on board, we have now been able to start working on establishing what is the real sickle cell burden and what are the real gaps that are missing for management and the proper care of these patients.
Western Kenya and the coast have the highest prevalence of sickle cell disease in Kenya. As in other countries in sub-Saharan Africa, 80% of those with the condition will not live to share their stories. As part of the Millennium Development Goals, the global community is committed to reduce deaths of children under 5. There has been progress, but sickle cell disease does not feature in the public health resources allocations. And so the deaths of Jane's 6 children illustrate the crisis facing communities in Africa, where there is no systematic health delivery system for the condition. The Shikuri Project exists to change that and save lives by raising awareness and with national and global partners deliver targeted low-cost services to communities. These include early diagnosis and medicines such as daily penicillin, training of families and health workers. But we need help. Join us at linkforlife.com, or shikuriproject.com, and let's create the change.